Hi, today we're going to be looking at a little case study. What I have is the ankle of a 72-year-old female who over 40 years ago sustained a trimalleolar fracture of her right ankle when she was walking around in the garden. And back then they did not do an ORIF, they did not do any surgery, they merely mobilized it back into place, reduced it, put a cast on her, and said don't walk on it for 6 weeks. When they took the cast off, they said you can walk on it if you want, which she did. So here we are 40-something years later, and just last year she started noticing pain in the ankle and difficulty walking. When I took a look at her, she had very limited plantar flexion. And that is presumably because the head of the talus was impacted up in between the fibula and the tibial dome. So the typical thing that you would do then, of course, is to mobilize it. And what we usually use when we're mobilizing is the metacarpal phalangeal joint of the index finger. And you get that right in on the dome of the talus. You distract a little bit using the lower hand as well. And as you try to plantar flex the foot, you mobilize the dome of the talus posteriorly, which gives you more and more motion. The other thing you can do is just fold your hand this way so that your fourth fingers are, again, resting on the dome, and you can stabilize here with your thumbs and just distract a little bit towards you to give you a little extra space in there. And when we did that, we heard a nice audible pop after about the second visit. But something that came up to me is if I take my foot and I can rest it up on something, I was actually able to rest her foot right here, go ahead and reestablish that position with those fourth fingers locked over the dome. I can distract, and I can actually use my knee to help stabilize as I increase my force and just go up and down while I'm plantar flexing and dorsiflexing my foot to assist me in the mobilization. And the other thing that I like to do is hold the foot tight, and I can shift her side to side and work on her medial and lateral mobility while I get a good grip going on at the ankle mortise. Okay, so that made a nice difference. What I will then do is get her foot right here, and I would do a muscle energy technique, which involves her pushing with about 20% of her effort on my shoulder for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax, take a deep breath, and I just gently stretch, 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 to increase whatever length we can get out of the Achilles tendon, and I'll do that 4 or 5 times. And then the last thing we found very helpful was to have her get a rocker bottom shoe, and this improved her gait tremendously.